Hi, and welcome to this short series on bacteriology for emergency physicians. The series is going to look at bacteriology, the characteristics of bacteria, particularly the things that would help us as emergency physicians understand bacterial pathogens better and make more sensible decisions with regard to diagnosis and treatment. This first talk is going to focus on the classification of bacteria, particularly those bacterial pathogens that you're likely to come across in the emergency room. As usual, we start with a case. This is a 24-year-old male who presents to the emergency department with fever, generalized skin rash, and a painful swollen knee. Synovial fluid is drained from his knee and sent to the lab, and it shows gram-negative intracellular diplococci. I'd like you to pause the video and figure out how this report helps you to identify the likely pathogen and how this might determine further treatment in this patient. So here are the objectives of this short talk. At the end of the session, you will be able to describe the morphological characteristics used to describe bacteria, to list the different categories of bacterial pathogens, provide some examples of specific bacteria in each category, and discuss how this classification assists in diagnosis and treatment. That last objective will be covered over all the talks in this short series, not just this one. Before we start, it's worth looking at the difference between eukaryotic and prokaryotic cells. Eukaryotic cells are the cells commonly seen in multicellular organisms such as human beings, whereas the prokaryotic cells are the types of cells that bacteria are made of. I just want to point out a few small differences. Firstly, the prokaryotic cell, the nuclear material is found within the cell but not distinct from the rest of the cell. There is no nuclear membrane separating the nuclear material from the rest of the cell tissue, from the rest of the cell contents. In addition, the prokaryotic cell has a cell wall outside of the cell membrane, which is often lacking from eukaryotic cell and certainly isn't a characteristic of human cells. Cell walls are seen in some eukaryotic cells, particularly plant cells. Prokaryotic cells may further have a capsule external to the cell wall, and some structures such as flagellae or villi or adhesion molecules on the cell wall, which further enhances the functioning of the bacterium. Let's think about the characteristics of bacteria that we can use to classify and describe them. One of the big characteristics is the cell wall, and the structure of the cell wall can divide bacteria into gram-positive, gram-negative, or atypical bacteria. When bacteria are stained with gram stain, and then they fall into two categories, gram-positive and gram-negative bacteria. The gram-positive bacteria have a more robust, structured peptidoglycan cell wall, whereas in the gram-negative bacteria, that peptidoglycan cell wall is not as well made, and they may have lipopolysaccharide structures within their cell wall as well. The gram stain adheres to the peptidoglycan cell wall, and therefore that purple staining remains after elution, whereas with the gram-negative bacteria, the purple staining is washed off, and therefore the gram-positive bacteria look purple, whereas the gram-negative bacteria look pink. We also have some atypical bacteria which don't stain with gram stain, and this is either because they lack a structured cell wall, a peptidoglycan cell wall, or they have other polysaccharide or complex molecules in their cell wall which don't take up Gram stain. Bacteria can also be described in terms of the shape. The two common shapes we see are cocci or spheres, and bacilli or rods. But other shapes can occur, such as spiral shapes in more complex and larger bacteria, and the Vibrio bacteria have a specific comma shape. The means of respiration can be used to divide bacteria, and this can be quite important in the clinical setting. So you have aerobic bacteria which require oxygen for tissue respiration, and anaerobic bacteria which produce energy without oxygen. Then you have bacteria that may sit in between these, so the microaerophilic organisms can live in conditions of very low oxygen tension, whereas facultative aerobes are anaerobic bacteria which can, if necessary, utilize oxygen for energy production. Then there are other features in bacteria that can be useful in distinguishing them, particularly within groups. So for example, if we're looking at different gram-positive cocci, certain characteristics can help us distinguish one from the other. And these could include the presence or absence of capsules, the presence of flagellae or villi, their ability to aggregate and how they aggregate. So some might aggregate in long strings, while others might aggregate in clumps, and their ability to form spores. So one way of dividing bacteria is according to their cell wall structure. So we can start with the gram-positive bacteria, and these can be further subdivided into cocci or bacilli, and each shape, so the cocci, can be divided according to their respiratory characteristics into aerobic and anaerobic organisms, as with the bacilli. So let's start at the top with aerobic cocci. These are fairly common pathogens, particularly of the respiratory system and soft tissues. Some common organisms that you would be accustomed to are Staph aureus, Strep pyogenes, and Strep pneumoniae. There are also anaerobic cocci such as Peptostreptococci, Peptococci, and Anerococci, often seen in anaerobic soft tissue infections such as infections to the floor of the mouth, or retropharyngeal abscesses, or anaerobic infections in tissue subject to poor perfusion such as wet gangrene, or certain types of gas gangrene as well. If we move to the bacilli or rod-shaped bacteria, there are aerobic gram-positive bacilli that are important pathogens, such as Corynebacterium diphtheriae, causing diphtheria, Bacillus anthracis, which causes anthrax, Bacillus cereus, a serious cause, an important cause of bacterial gastroenteritis, and Listeria monocytogenes, which causes listeriosis. And then finally, anaerobic gram-positive bacilli, such as the Clostridia, characterized by their ability to form spores, and other anaerobic bacilli, such as the Actinomyces, and Lactobacillus. These are non-spore forming. We can then move on to gram-negative bacteria. So the aerobic gram-negative bacteria would include Neisseria gonorrhea and Neisseria meningitidis. And if we reflect back to the case we started with, clearly this was a patient with disseminated gonococcal infection from Neisseria gonorrhea, a gram-negative intracellular diplococcus. Moraxella catarrhalis, an important cause of sinusitis, is also a gram-negative coccus. We also have anaerobic cocci as well. The main group are the Veillonella, and these are often seen in anaerobic soft tissue infections, but often not identified because they can be quite hard to grow in the lab. Then we can move on to the aerobic bacilli, such as the Enterobacteriaceae, E. coli, Proteus, Klebsiella, really common names, and then others such as Pseudomonas and Acinetobacter, which are non-fermenters. And finally, we have anaerobic bacilli, which are gram-negative, such as Bacteroides and Fusobacterium, again often seen in anaerobic soft tissue infections. Finally, we have the atypical bacteria. Classically, these are really referring to intracellular pathogens, obligate intracellular pathogens such as Mycoplasma, Chlamydia, Coxiella, and Legionella. But other bacteria are not typically stained by grand stains, and the two big groups are Mycobacteria and spirochetes. So that was a really brief introduction to the classification of bacteria. Our subsequent lectures will expand on each of these groups. If you have any questions, you can bring them up in class. So in summary, we looked at gram-positive, gram-negative, and atypical bacteria and described a classification system for these. Thank you.